This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
As they were saying, we're St. Luke's Rehab. We're located in Spokane, Washington. There are three of us here currently in the room this evening with you. Myself, I'm Bryce Green. We also have Tyler Bates, he's a PGY3, and Kate Whiteneck, who's one of our chiefs. She is a PGY4. As you can kind of, see just from where we're all from, we kind of come from all over the place from a lot of different and have had our PGY1 intern years kind of all over the place too. So we're kind of a culmination, which we think is kind of cool. But that is actually going to be changing. At the very bottom is all of our email addresses. I'll kind of come to this slide here towards the end again. So that way, if you guys want to contact any of us, I can get that back on for you. So as I mentioned, our PG1 years, it's going to be changing because we've become a categorical program. So starting with this next year, we're going to have 6 new residents coming in that are going to be primarily at our hospital next door, which is Sacred Heart Medical Center. It's literally just 2 blocks away, easy walking distance. St. Luke's itself is the largest freestanding hospital in the Western U.S. Originally opened in 1994. We've got 102 rehab beds. We are a level 1 rehab hospital, and we are CARF accredited for both adults and pediatrics in brain injury, spinal cord, stroke, and amputee. Of note, our brain injury clinic is also a locked unit. That's a nice resource to be able to have. We do also have extensive research programs with hundreds of peer-reviewed publications. Some of the facility that we have, or our faculty that we have, I should say, they are widely recognized kind of across the nation. They're a phenomenal resource, especially if you're interested in research. I actually ran into Dr. Carter, our program director, down in Florida during one of the PM&R conferences down there that was this last year. So back to our facility, we have one of the largest catchment areas in the US. We technically get, folks from five states, obviously Washington, Oregon, Idaho, and Montana. We do also get quite a few people from Alaska and Canada. And, quite frankly, taking a look at this map, this map shows a smaller catchment area from what I've actually seen, because we do take folks all the way from Billings, Montana also, which is kind of closer to that eastern side of the state. So as you can see, we've got a lot of folks that will end up kind of coming to us. So as far as our rehab center itself, we're attached to Inland Imaging, which is really nice. So, they're able to provide us with the x-rays, CTs, and MRIs and MBSs basically anytime throughout the week. So, really important for us just because we are a freestanding hospital. So if suddenly one of our patients start to show, an acute neurologic change, we can really actually just buzz them down one of the hallways, get some imaging done, and see if we don't need to actually go further on with sending them back to the hospital, which again, like I said, is just 2 blocks away. We've got really good working relationships with EMS in the area also, so we're able to get them there pretty quick. As far as in-house partners are concerned, we always work with speech, OT, PT, and neuropsych. One thing that's actually not on the slide is we actually have recreational therapy also. Really important to be able to get folks back to doing the things that they love. I actually had a patient just last month. She was like 95, and she was concerned that she wasn't going to be able to ride her ATV anymore, which I thought was fantastic that she was still doing that. We got some things figured out for her. So, and then, also we've got, social workers, case managers, respiratory therapists, pharmacy, and wound care nurses. we work on a daily basis with all of these folks. We also do have the interdisciplinary teams every week where we'll talk about each and every single one of our patients to make sure that we're, all kind of on the same level for exactly what they need, see how much more rehab we can be able to get them with their time with us. And then, as I mentioned, there's a Sacred Heart Medical Hospital. That's a level 2 trauma center just down the street. And then, while we're there, we've got inpatient consult rotations. And then we also, those guys perform a lot of our lab draws from St. Luke's. And then they're the primary ones that we'll actually send folks out to if something happens. So really close by, they're a great resource for us to just be able to call, even if we've got questions from some of their specialists there. As far as, inside of St. Luke's, we've got a huge rehab gym that's kind of on our second floor. And then we've actually got a couple smaller gyms kind of scattered throughout too, depending on, that specific patient's needs. But within our larger gym, there's also a pool right around the corner that has lift systems where we can have patients that are over 500 pounds actually be able to go into the pool. So that way they can be able to do their water therapy. And then we've also got cardiac and pulmonary rehab programs there within St. Luke's, as well as assistive technology from the Locomat trainers to the zero-G systems. We also have this unique little community simulation area as well. In there you can kind of see pictures where they've got the grocery store, like a bank type financial institution, a restaurant, law office, and transportation. Specifically, I want to point out within that transportation, if you can see that little blue, yellow, and red guy in the center, that's actually part of a plane fuselage that we're able to get donated to us. So that way, folks really can see, okay, this is how I'm going to be able to transition into a car, a plane, or even one of the city buses. So that way they just gain a little bit more confidence as they, leave St. Luke's eventually. And then we do also have an independent living apartment. And basically what they'll do is they can practice all of their needs from at home. So, from cooking to sleeping, they can literally do everything that they would at home, be able to do at home. And so again, they just feel more comfortable, or sometimes we can use it to show more deficits and things that folks need to make sure that they're able to focus on just a little bit more while we've still got them there in the hospital. We do also have a community therapy area with the terrain park. And so obviously, as you guys can see, we've got a bunch of different terrains from, the cobblestones to just the regular concrete to little rails and stairs, again, with plenty of, and ramps with plenty of handrails. That way folks can, confidently be able to work on going up and down those things. Our recreational therapist will frequently work on with folks in those areas. He jokingly told me the other day that he was going to take somebody off-roading with their walker. So because that's what she used to do at home, and to get her back doing that. We do also have a nice attached waterfall cafeteria just in the back of St. Luke's. And it's really nice to just be able to sit out there, and just take a look at that waterfall while you're having lunch. Just have a nice little bit of a break before you kind of get back to patients. It's a good area to kind of recharge. And it's really nice kind of at night too, as the sun is starting to go down. We do also have quite a bit of opportunities for both adaptive sports and volunteering opportunities. We've got the Providence St, which are a competitive wheelchair basketball team. And then every July, we've got Ski Fest, which is adaptive water skiing, swimming, and boating. And then we do also have downhill skiing and other adaptive snow sports just at Mount Spokane, which is just a little ways down the road. The Saints annual adaptive golf tournament also happens annually. That's each September. And then we've got the Spokane Velocity and Zephyr, which is a soccer team. We've got sideline coverage for them too. So that way we can get a little bit of extra sports coverage going down that line. As far as rotations are concerned, we've got these pretty well broken down. For the most part, throughout your PGY 2 year, you end up doing, most of your time through the inpatient rehab side of things, between the spinal cord, brain injury, neuro rehab, amputee, and the general rehab clinics. And then we do also do a little bit of general outpatient side. We have a rheumatology rotation, which is fantastic over at Sacred Heart. orthotics and prosthetics, also skilled nursing facility and MSK. So that way you don't spend your entire first year just within the rehab hospital. You kind of get to see a little bit of the ins and outs of how the inpatient and outpatient kind of situations can work, especially I think that's especially good before you start trying to start taking a look into fellowships and things of that nature before some of those applications you need to be ready for. As far as our PGY 3 year, we do have a pain management, which is in Swedish Hospital over in Seattle. So our program actually puts us up in a really nice uh, kind of Airbnb for the month that we're there, and they take really good care of us. Families are able to come out with us within reason, of course. And then we do also have sports and spine, inpatient consults, MSK, and then our numerous outpatient clinics with neuromuscular diseases and EMGs, muscular dystrophy and ALS, the hereditary neuropathy foundation centers, all those. And we've got several neuromuscular trained physicians actually within our outpatient clinics, which are absolutely wonderful to work alongside. As far as our PGY4s, that's where we've got the inpatient senior rotation where they're really simulating, what's going to happen when you're actually out in practice. What they're doing is they're kind of allowing us to have more supervision over the PGY3s and 2s while you're in there and kind of get you into a little bit more of that teaching role as well, which is absolutely fantastic practice. We've also got the pediatric rehab over at Shriners, which is here in Spokane, along with a little bit more of the inpatient consults, sports medicine. And then we've got a bunch of different off-site and on-site kind of select up options for different things that we can do if you're really interested in certain areas or wanting to learn more, shore up things like neurology or your movement disorders, things of that nature. And then it is also possible that you can be able to do some research time or, again, more skilled nursing facility, depending on where your interests lie. As far as our call schedules are concerned, right now, this is kind of an ever-changing thing. We do 7 days, 7 days or 7 nights. And basically you kind of go back and forth between those two. So not as a consistent thing, but you're in a constant rotation with between the 2s, 3s, and 4s. Of course, with the first year, the PGY2s do take the most call out of everyone, and then it progressively decreases down as you're kind of going through. And then we do have on-call attendings, which are always available at all hours, so you're not totally alone at any point in time. And then the on-call day team, they do round on the weekends. So as long as you're not on call, every weekend that you have is actually a golden weekend, which is absolutely phenomenal. As you can see there, we actually have pictures of our on-call room, private bath and shower. And then you've got your own private workstation there. So that way, if you do get a call, not every time do you actually need to go and see the patient. But if you do, we're going to be right there and ready to go for when you need to. This is our procedures, which I'm actually going to have Kate kind of step in and just kind of talk about this for just a second.
Yeah, and I apologize. I got a new computer monitor. My video is not working, but hopefully you guys can hear me okay. I wanted to put up two examples of procedures that we've done, mostly PGY 3-year. There's kind of a big discrepancy between these two. And the reason being, on the left are my procedures. I'm more interested in general rehab, whereas on the right is my co-resident Trevor's, and he's more interested in sport and spine. So whereas I was better about entering my EMG and Botox numbers, he was much better at entering his axial injections and joint injections. So we do get a ton of procedures. I still have however many more months on outpatient doing EMGs, so I'll be well above 250, if not 300, and that definitely sets us up for success on boards in terms of EMG questions, and we get a lot of Botox exposure. So it's a really great program for procedures. And then when you look at Trevor's and the axials, some of those are over at Swedish, and the others, we have several sport and spine rotations within Spokane where you're doing a ton of procedures. You end up doing probably, from what we've heard from fellows and sport and spine or pain fellowships, we might get even more procedures than they do. So that's kind of cool if you're into those kinds of procedures. Yeah, thanks, Bryce.
Awesome. Thanks, Kate. Yeah, so, and as far as our benefits are concerned, you can see the salaries there. We do obviously get the yearly increases just like anyone else. And then we do have a $1,000 educational stipend over the 3 years. We can use that both for research, as far as like doing conference attendance or books, things like that. Should be mentioned though too that, as far as books are concerned, we do also have online databases through the University of Washington. So a lot of our books we're able to actually get for ebooks through there. So you can use that educational stipend for other things. And then they do also give us a $3,000 a year food stipend for the cafeteria that's in-house. They do have that split just a little bit between both St. Luke's and Sacred Heart, just because we do actually have rotations in both areas every year. So they kind of change that up just a little bit for us, but they do have that. And then we do have free parking on site, and we've got security there, of course, all the time also. So, your stuff is quite safe there. As far as, our resident rooms and kind of work areas, we've got dual monitors for everything. We've got Dragon dictation devices for each of our residents if you prefer the dictation method. We do have standing desks for every single one of the resident spots. And then we do have just multiple work areas, so we've got one area that is just for the residents, and we've got attendings nearby where they can work, or we've got places that are down on the floors closer to the patients if that's where you prefer to work. Either is perfectly acceptable. We've got residents every year that kind of go into both areas depending on where you're the most comfortable and wanting to work. As far as our vacation and CME, we've got 1 week blocks, 3 1 week blocks for our vacation times, which we have kind of scheduled throughout the year, and you kind of have your choice depending on your preference and where we've got availability for coverage for things that you can select, so that way you make sure that you have time off. But then in addition to that, you have an additional 5 days that you can take throughout the year, whether that be as personal time, or if you have an appointment or something that you need to get to, or your sick days. So that way you've got that covered. And then in addition to that, you've got 3 half days per year that you can use for personal days, wellness days. You can use those for doctor's visits, all kinds of things. And then we do also have 5 CME days per year that you can also take. And then, with Spokane being where it's at, the Sacred Heart also does have quite a few other residency programs, family med, internal medicine, psychiatry, pediatrics, and then transitional year residents. So I'm not sure how many folks are within all those programs, but we actually have a substantial number of residents just through Spokane every single year, just between all those different programs. And then, one of the big things too is we work one-on-one with our attendings. Every single day, you've got a single attending that you're reporting to, unless somebody's out sick or on vacation. And it's absolutely fantastic, because then you get to really figure out like, hey, this specific TBI service, you've got somebody who's specialized just in the traumatic brain injuries, and you can really pick their brain to kind of figure out, okay, what are the ins and outs that I need to know and I need to learn basically from this one attending, that, and try to get as much as you possibly can out of that rotation. You don't usually have to go to a lot of different people, kind of on your day to day. And then we do also have 3 different health insurance plans you could choose from, depending on what fits your family the best. And then we do also have a 401k with 50% match for the first 3%. As far as our didactics are concerned, we do have weekly protected time didactics, which are Friday mornings. And then all of those didactics are performed by our faculty that are there. And then during those, we'll also have some skill sessions with EMGs and ultrasounds. On top of that, we do also have different clubs that we actually have that are quite active, from osteopathic manipulative treatments to an ultrasound clubs. I can't remember all of the other ones, but we have a lot of other extracurricular activities that we're able to actually do to kind of help increase our own learning also. And then, of course, we've got journal clubs and medical case reviews that we'll go through. And then we've got a lot of scholarly activity with IRB approval that happens at the hospital. Dr. Carter, as I said, he's very interested in research, and he's actively trying to get as many of us as possible involved in as many research projects as we can, just because, number one, research within PM&R is incredibly important. And number two, because, hey, it really helps out our CVs, and it helps us to just kind of make sure that we move and have our careers go into the path where we really want to see them. Other lecture topics that we have, obviously, are the EMGs, the nerve conduction studies, peripheral neuropathies, myopathy, and neuromuscular junction diseases. And then we do all of our didactics on a 12-month rotating schedules. And then we actually have a PGY2 intro didactic series. So that way, because the PGY2 spend so much time within the rehab facilities or in the hospital, you really get a little bit more familiar with the various types of disease pathologies that you can be able to see, and especially see things like your SCI emergencies and TBI emergencies. So that way, if you are covering for some of those patients, you know exactly what you need to do or the direction that you need to take for when you are doing your call for those patients, earlier on. And so that way you get a little bit more comfortable with those types of patients, even if you're not taking care of them every single day. Then we've got Spokane, Washington ourselves. The population around here is 229,000. We really do have a true 4 seasons kind of weather. It's really the Rocky Mountain climate. So yes, we do get snow. Yes, we get snow. And it's beautiful and I love it. But then we also have a lot of different annual events from Lilac, Bloomsdale Run, Hops Fest, International Film Festivals, Blue Water Bluegrass Festivals. We're also consistently one of the top 10 rated cities for outdoor activities. We're also top rated Division I basketball team with Gonzaga. And then we've got the Pro Hockey League team, the Spokane Chiefs, and a minor league baseball team called the Spokane Indians. Also, just down the road, there's Coeur d'Alene, which, if y'all haven't heard of Coeur d'Alene, it's absolutely beautiful there too. I think it's like 35 minutes down the road. My family and I actually just went down there this last weekend and just spent some time on the lake. Absolutely beautiful. Tons of hiking, biking, just lots and lots of stuff to do out here. And then we do.
You off, Dr. Green. We're 2 minutes over now.
Oh,
yeah. I was giving warnings in the chat, but if you're okay to wrap up, if you have a couple last minute things, and with your contact information, you feel free to do that now, and then we're gonna wrap up for the evening.
Yeah, absolutely. Sorry for talking so long here, guys.
No, that's okay.
So yeah, we really are an excellent training. So we're an innovative program. The city that's around us in this area is absolutely fantastic. This right here, this is the contact information that we've got. We're over on Instagram. These are our program director, Dr. Carter, Alicia Furman, and Ben Carpenter, our assistant program directors. And then again, so if you want to jot down any of those names really quick, feel free to reach out to any of them. And then, of course, this is us. We're the team that's here in the room today. Feel free at any point in time, if you guys have any questions, please feel free to reach out. We'd absolutely love to hear from anybody.